What is fear? It is undoubtedly very difficult to describe the phenomenon of fear in a single sentence. Despite this, it is possible to explain fear as a feeling of imminent threat that cannot be controlled by will and logic and narrows one's mind. From a medical point of view, fear is accompanied by, in almost all cases, pale skin, sweating, tremors, or palpitations. Fear diseases, on the other hand, are considered to be a severe form of fear. The development of fear. Our fear is a phenomenon that develops only in the course of our lives. That is, we are not born as cowards, nor as particularly brave and fearless people. It is possible that we can perceive the first visible fear reactions in the period between the 4th and 6th months of babies. It is possible for children to endure being away from their parents for long periods of time, as long as they can retain an image of these persons within them. Healthy fear, pathological fear. Fear is, first of all, an emotional state that helps people stay healthy and survive. First of all, fear gives us the ability to be prudent and careful, both for ourselves and for the people around us. Just as pain has an important alarm function for the body, fear has a vital importance. For example, if we could approach a fire without fear and pain, it would be very easy for us to suffer life-threatening burns. In other words, fear also has important aspects in terms of health, of course. In this case, the phenomenon known as real fear is mentioned. Human in the face of an external danger, they are alarmed physically, emotionally, and at the level of the mind. However, everyone knows how the phenomenon of fear is experienced or perceived. For example, by giving another meaning to the situation that frightens us, when we hear noises in our house at night, we tend to attribute it to the cat walking around the house, not to the possible robbers in the house. But it is also important to have a reasonable degree of genuine fear. The dose of this fear should be enough not to be caught off guard in a risky event, but not too high to react, frozen with fear. You see, both extreme fear and low fear, up to the level of fearlessness, have the characteristics of illness. In case of extreme fear, you definitely need help, and your quality of life will also be limited. However, in case of fearlessness, it is possible to be socially compatible and successful. Although both these types of fear have the characteristics of a disease, it is a fact that the extreme fear case is more important. Classification of fears. There is a difference between fear and fear. Therefore, fear disorders are medically divided into 3 major groups. In this classification, the word disorder has been added to emphasize the sickening nature of each fear category. Fear disorder, general fear, unrelated fear. Panic disorder, or panic attacks, may be accompanied by fear of space, agoraphobia, or alone. Phobic disorder, depending on a particular object and situation. In all these states of fear, a clear demarcation between the normal state and the disease state is not possible. In this respect, first of all, the question of what size the fear is should be examined. For example, the question of whether a person who is generally able to feel fear relatively quickly becomes morbidly frightened plays an important role. For example, there are many people who are systematically afraid of boarding a plane, but who do not necessarily seek psychological help for this. The question of when the fear of speaking in the presence of other people reaches a life-limiting dimension and therefore should be treated with the help of a professional physician is often not easily predicted. Likewise, we do not know how morbid it is to be afraid of spiders, for example. For a better understanding of the subject, let's first examine the 3 different forms of fear disorders a little more closely. General fear disorder. General fear disorder is when the fear symptoms persist on most days, for at least a few weeks. Among the most important symptoms on which the doctor diagnosing this disorder bases his diagnosis are the following: anxiety, feeling tense, being excited, having difficulty concentrating on a particular phenomenon. Motoric tension, e.g., trembling, feeling tight in muscles, inability to remain calm. Excessive vegetative, uncontrolled reactions, for example sweating, dizziness. Panic disorder. As the medicine recommended by your doctor is for the treatment of panic disorder, this leaflet's What is Panic? The subject is dealt with in more detail under the title. Phobic disorder. A phobic disorder is a state of fear that is always associated with a specific situation or object. Object-related phobia is a state of fear associated with a particular object, such as a spider, snake, or fire. Thank you for watching the video. Don't forget to subscribe and like.